Hi guys, this is Dr. Christopher James Macario, and this is another explainer. And this time, this is going to be about respiratory drugs. Okay, and on the first few explainers, we have discussed several drugs, like yung sinasabi natin cardiac drugs and diuretics, and this time around respiratory drugs. So, these are all connected. Okay? From yung una, yung diuretic drugs which promote diuresis. And doon sa sinasabi natin cardiac drugs, the different cardiac drugs. And in relation to the respiratory drugs, it means that your respiratory system and your circulatory system are partners. So, meaning, pagka nagkaroon ng problema, either one, whether it's a respiratory system problem or an oxygenation problem or a circulatory problem, pag sinabing circulatory problem, it pertains to problems with the heart, problems with the peripheries, and problems with the blood. Okay? So, dun umiikot yung mga medications natin. Okay? So, with the respiratory drugs, we'll be talking about several actually, and we might, cross paths with some drugs that we have already encountered kasi nga sabi nga natin, hindi pwedeng pag-usapan yung respiratory drugs without talking about its effect to cardiac drugs and vice versa. Okay? As for the objectives, you are supposed to accomplish the following objectives: understand and know the drugs used for the upper and lower respiratory drugs. So we will be discussing both kasi ang dami ang drugs. Okay. A little introduction about the respiratory system. So it's the most important psychological need catered by the respiratory system, and ano daw yun? That is breathing. Okay, with the physiologic needs, sasabihin natin na food, clothing, etc. Dito ka mamamatay sa breathing. So we give very, very high importance if the problem is about breathing or circulations. Siguro lalong-lalo na if we talk about the nursing process and yung prioritization niya. So, number one is yung sinasabi nating breathing. It's one of the top priorities. With breathing, the body is able to supply what it needs from number one, regulation of gas exchange, or the exchange of O2 and CO2. Remember, this exchange, or as what I call, this magic happens yung sinasabi nating sa lungs, specifically in the alveoli. The alveoli, ito yung link ng respiratory system and ng circulatory system, whether it's going to exchange O2 for CO2 kung ano, circulatory system, and vice versa, CO2 i-exchange naman yung O2 pagka yung respiratory system naman. Number two, regulation of pH. Remember, bakit nandyan yung regulation of pH? Yung katawan natin, again, is a factory of acid. Why? Kasi kapag ka mayroong input, merong output. Yung input, one of its input, of course, yung sinasabi nating oxygen, and the byproduct, yung sinasabi nating metabolism, is your CO2 or your carbon dioxide. And in nature, carbon dioxide is acidic. And hence, mababalik tayo ulit. It is one of those that regulate the pH. Okay? Number three, importance of your respiratory system is the production of sound. 4, it's used for olfaction, and 5, protection against pathogens. However, with the changes in the internal and external environment of the body, the respiratory system at times develop problems. Ano ba yung mga problem na yan? I think one of the problem is aging. So, or probably environment, or yung sinasabi nating infection. Okay? It's divided into your upper and lower respiratory system as would any anatomy teacher teach. So, subdivided daw sa dalawa na yan. And hence, the use of respiratory drugs. Kung ano man problema na yan, the manage would, always be different at the same time. Okay, kasi may mga ibang diseases, it's managed pareho. However, minsan, magkakaiba ng management yung doctors. It's like saying yung 2 plus 1, diba? 3 plus 4 is equivalent to 7. Pero pwede rin mo naman gawing 6 plus 1. So, regardless, pareho lang din naman yung gusto nating outcome. Okay? And so, with all that introduction, and before we talk about anything about respiratory drugs, you have to know or be aware that the goal of respiratory drugs is isa lang naman. It is adequate gas exchange. So, kahit ano pang type ng drug yan, or respiratory drug should I say, it all boils down to adequate gas exchange. Yan ang gusto nating mangyari. Okay? So basically, the respiratory drugs decrease mucus production and constriction. So, ang nagiging problema kasi pag sa respiratory system is nagkakaroon siya ng overproduction of mucus, or pwedeng nagkakaroon ng constriction. For example, yung mga asthmatic, kaya nagkakaroon sila ng wheezing, yung parang high-pitched sound, yun, constriction yun. Or both. Pwedeng there is an overproduction of mucus and constriction. And so we'll talk about the drugs na nag-effect, whether it's constriction or mucus production. But remember, kahit na ano pa yung problema niyan, there is only one goal, and that is adequate gas exchange. With the organs of the respiratory system, I know na natakal nyo na to sa anatomy and physiology class ninyo, but konting review lang. So sabi nga natin, the respiratory system is divided into two, which is the upper and lower respiratory system. So from the head hanggang sa sinasabi nating larynx, it's safe to say that it's part of the upper respiratory system. And below, yung sinasabi natin sa trachea, going to the bronchus, papunta dun sa lung, yung sa dalawang lung, dun sa right and the left lung. Okay? Ang tingin ni surgeon sa lungs na yan is parang reverse na tree. Okay? And from there, nagsisplit pa yung mga bronchus natin into smaller and smaller pieces hanggang sa makarating siya dun sa sinasabi nating where the magic happens. When I say where the magic happens, I am pertaining to gas exchange. And that link between the circulatory system and the respiratory system is your alveoli. Just a quick Q&A. So, yung alveoli natin, for example, mahilig kang magyosi. Okay, nag-expand yan. Nag-expand, tapos tumitigas. And so, pag hindi siya maka-expand, yung sinasabi natin gas exchange decreases. Okay? So, yun yung nangyayari dyan. Or in some cases, okay, kapag ka nagkakaroon ng accumulation of mucus, yung mucus normal yun. But with several cases, okay, for example, infection or a disturbance in the balance of your sympathetic nervous system and your parasympathetic nervous system. Nagkaroon ng disturbance ng balance dyan. Or for whatever reason, nagkakaroon ng sinasabi nating constriction of the airway or overproduction of mucus. Yan, dyan nagkakaroon ng problema sa gas exchange. The classifications of drugs used for the respiratory system include number one, you have your antihistamine, your decongestants from the word itself, decongests, okay? Your anti-inflammatory or yung sinasabi nating steroids or yung glucocorticosteroids. We have your antitussives, you have your expectorants, your dilators or bronchodilators from the word itself. You'd have to know kung ano ginagawa niya. Your anticholinergics. Explain natin kung ano ba yan. Anticholinergic versus cholinergic. Your mucolytics. Your methylxanthine derivatives and your antibiotics. Kaya lang yung antibiotics, na-discuss na sa inyo yan ni Sir Immaculata or ni Ma'am Trinidad. So, classifications of drugs used for the upper respiratory system. Number one, you have your antihistamine. You have your first and second generation. So, magkaiba yung dalawa na yon because there are more side effects of your first generation as compared to your second generation. You have your decongestants. Number three, intranasal glucocorticosteroids. Number four, you have your antitussive. You have your non-opioid antitussives. And your opioid antitussives. And you have your expectorants from the word itself. Expectorants to expectorate those unwanted overproduced mucus. Drugs used for the lower respiratory system includes your bronchodilators, glucocorticosteroids, leukotriene modifiers, expectorants, antibiotics, anticholinergics, mucolytics, and methylxanthine derivatives. Dami, no? From the upper respiratory system, yung iba merong commonality or merong the same medications given like your bronchodilator, yung antibiotics. Okay? Kasi ganun talaga eh. Okay? Nagkakaroon ng problems with the upper and respiratory system. And like I said, may mga management na pareho naman talagang ibinibigay. Okay? So, para magkaroon tayo ng idea, eto yun. And so, to make it easier, I have subdivided those medications into two. And those are Team Broncos, meaning BAM. Mamaya explain ni Sir yun kung ano yung BAM na yan. And their anti-inflammatory agents or SLAM. So, kung i-categorize ko sila, kung bibigyan ko sila ng summary, it's BAM, SLAM. Pero pauso lang ni Sir yun kasi SLM nga. Okay? For Team Broncos or bronchodilators, that's B, that stands for B or bronchodilators. A for anticholinergics, and M, methylxanthines or its derivatives. As for the anti-inflammatory agents, S for steroids or corticosteroids, L for leukotrienes, and M for mast cell stabilizers or cromolyn. As we move along, i-explain ni Sir yung BAM at saka yung SLM or SLAM. For Team Broncos, let's first talk about B or bronchodilators. But for others, pagka gumagawa sila ng mnemonics, ang tawag kasi nila dito is beta-2 agonist. So instead of bronchodilator, ang ginagamit nila beta-2 agonist. Pareho lang yun. I may interchange it sometime, but no, I am thinking the same. Bronchodilator and beta 2 agonist. And what it does is it relaxes the smooth muscles. And usually, medications belonging to beta 2 agonist ends in terol. Okay? Next is A for anticholinergics. These agents that bring down mucus production in pathways like the bronchi and the bronchioles and helps dilate bronchial tubes. Sabi ko sa inyo kanina, there are several problems pag pinag-usapan natin yung respiratory system. Okay? Sometimes the problem is with the overproduction of the mucus. And yung mucus natin, in those areas, yung sa respiratory system, not only that, sa GI system, and with all those, basta merong epithelial cells. Ang epithelial cells, ano yan? We have to talk about the tissues, but I'm not gonna talk about the tissues right now. Basta may epithelial tissues, it is able to produce mucus, and mucus plays a very important role in the human body. However, sometimes nagkakaroon ng overproduction ng mucus. Sometimes it's bad, okay? Sometimes it's good, but definitely, nagkakaroon ng problema sa gas exchange if there is an overproduction of mucus in the airways. Okay? Especially dun sa bronchi or sa bronchioles. Or, like I said, nagkakaroon din ng sinasabi natin constriction or both. So, this anticholinergic, ito yung sinasapol niya. Yung overproduction of mucus, and it also dilates bronchial tubes. These drugs often ends in pium, P-I-U-M, excretes H2O or let's UP. Mamaya pag-uusapan natin yung relationship ng peeing, or to be more specific, the relationship or the balance, ang tingin ni Sir Ciso doon sa sinasabi nating sympathetic and parasympathetic nervous system. We'll talk about that. And you have your methylxanthines. Ano ba yan? They are the ones that cause your sympathomimetic response. But ano ba yung sympathomimetic response? For you to be able to understand, it simply means an SNS response, or your sympathetic nervous system response. Okay? Yung effect niya parang caffeine. Pagka ikaw uminom ng caffeine, ano nangyayari sa'yo? Gising ka, right? Sometimes pag hindi ka sanay uminom ng caffeine, yung heart mo mabilis yung pag-pound. In short, it's the one that activates your fight or flight. So meaning, it's either you're fighting or you are flighting. Okay? And it increases the heart rate and opens up the lungs to make you breathe better. So it's also a bronchodilator, and the drugs under this classification often ends in phylline. Team anti-inflammatory. From the word itself, anti-inflammatory, meaning merong inflammation, anti-inflammation. So it counters the inflammation. Bakit nagkakaroon ng inflammation? Is that normal? Yes. Normal defense ng body yun. Okay? So anti-inflammatory agents causes smooth muscles, bronchi, and bronchioles to relax. However, with the use of anti-inflammatory, okay, it goes hand in hand with immunosuppression. Pwede mo siyang i-categorize yung mga sinasabi nating mga immunocompromised. Ito yung mga sinasabi nating nagkakaroon ng treatment for cancer or yung gumagamit ng cancer drugs. I'm not saying pareho sila. All I'm saying is that those people that use anti-inflammatories, okay, are immunocompromised. Kasi itong mga to, for example, yung steroids, pinoproduce natin yan normally. But if the body receives that from someplace else, okay, sinasabi natin na, okay, mag-ano muna kanyan. And the effect is bumababa yung resistance natin or yung immunity. Okay? But like I said, magkaiba yun. I'm not saying pareho sila. Yung pareho lang sa kanila is merong tinatawag na effect na immunosuppression. Okay, let's start. With the S or yung SLAM, yung sa S pertains to your steroids or corticosteroids. Our body already produces this. So if we discontinue, we have to taper off. Our adrenal glands need time to produce steroids, meaning sa human body kasi natin, itong mga gamot na to, okay, pinoproduce to ng katawan natin eh. All of the medicines, pinoproduce ng katawan natin. However, itong sa steroids kasi, we have to remember that yung mga clients na gumagamit nito, kailangan we taper them off. Anong ibig sabihin nun? What does it mean? Meaning, if you give, for example, two tablets every day, okay? So, kailangan kung i-withdraw mo na yung anti-inflam na yan or yung steroids na yan, sasabihin ng doktor or yung management niya to taper off that particular patient is gagawin niyang 1, tapos 0.5 hanggang sa mawala. Why? Kasi the moment we introduce yung sinasabi nating steroids or yung corticosteroids, it tells the adrenal glands, meron naman palang nagpo-produce nito, huwag na ako mag-produce. Okay? So, whatever the adrenal gland thinks, hindi nga siya magpo-produce ng ng steroids. And so we taper off. So, during the course of the treatment, kung taper off na siya dyan, the adrenal gland, what it does is it senses that at konti-konti, okay, nagpo-produce na siya ng steroids hanggang sa ultimately, nagproduce ulit siya ng normal na ginagawa niyang steroids. Okay? Next is your leukotrienes. From the word itself, leukotrienes, it stabilizes the leukines. Pero ano ba talagang ginagawa ng leukines na yan? They are blood cells that cause prostaglandin to be produced. Ulitin natin. Let's repeat it. Leukotrienes are blood cells that cause prostaglandin to be produced. Okay, let's encircle prostaglandin. Okay, isipin natin yung prostaglandin. Ano ba yung ginagawa ng prostaglandin? Okay, prostaglandins are the reason for the inflammation. Pati yung sa pain, pero hindi natin pag-uusapan yung pain. Okay, it's one of the reasons for inflammation. And by decreasing it, yung prostaglandin, decrease swelling or inflammation. Okay, ulit. Prostaglandin is one of the reasons for inflammation, and by limiting prostaglandin, we also limit or decrease swelling or inflammation. Okay? And the last one, the mast cell stabilizers, okay, or yung cromolyn, ito yung mismo yung gamot. And the classification is your mast cell stabilizers. So, ano ginagawa niya? So, to understand this classification, we have to know ano ba talagang ginagawa ng mast cell. Narinig na natin yan, diniscuss na natin yan during our previous years, anatomy and physiology. But reviewin lang natin. Mast cells open up blood vessels and cause blood to rush into smooth muscles, bronchi, and bronchioles. And when that happens, the bronchi and bronchioles become inflamed and puffed. So, yung pag-rush ng mast cells sa bronchioles, sa respiratory system, lahat naman yan smooth muscles, di ba? Okay, so what happens is nagkakaroon ng inflammation or yung branches ng yung sa reverse na puno, yung sinasabi ni sir, where the gas exchange happens. Okay? Nagiging puffed siya. And if it's inflamed, then yung trabaho niya, yung goal niya, which is gas or adequate gas exchange, is impaired. And by giving this medication, yung swelling nare-reduce. And so all this, yung steroids, yung leukotrienes, and mast cell are all anti-inflammatory agents, but they work in the different parts of the respiratory system. Yung isa acts on the leucines to prevent prostaglandin, okay? And the other one concentrates its efforts on your mast cells. Let's talk about bronchodilators, or otherwise termed as beta 2 agonists. So, kanina sinabi natin, it relaxes smooth muscles and cause dilation of the bronchioles. Kasi nga minsan, yung problema is nagkakaroon ng constriction. And an example of yung constriction natin is kung if you know somebody na merong asthma, okay, so yung pinakamaliit na passageway ng respiratory system dyan, nagkakaroon ng constriction, and that is why it produces high-pitched sound kapag humihinga sila in and out, in and out. Okay? Vasoconstriction. So, dito pumapasok din yung pwede ibigay ito. These are used to assist in opening narrow airways. It may also be called your sympathomimetics from the word itself, sympa. Okay? Sounds like sympathetic nervous system. Yes. Okay. Medication names that end in terol. Example, albuterol. Okay. In an acute bronchospasm caused by an allergic reaction, epinephrine is given sub-Q to promote bronchodilation and elevate BP. So we have several. We have your alpha and beta adrenergics, yung epinephrine sulfate and your epinephrine, and your beta adrenergics or yung beta 2 na sinasabi natin, yung albuterol, formoterol, levalbuterol, metoprolol. Pero yung pinaka palaging nakikita dyan sa hospital, okay, and in books is your albuterol, levalbuterol, salmeterol, or terbutaline sulfate. Yun lang yung naiiba, terbutaline sulfate. So before we get to the next topic, which is your anticholinergic, we have to talk about several things first. Let's start with your cholinergic versus anticholinergic and the difference between your sympathetic and your parasympathetic nervous system so that we may better understand the difference or the effects of your anticholinergics. Okay, ano ba yung difference ng cholinergic versus anticholinergic? But more importantly, ano ba yung cholinergic na yan? Or cholinergic effect? Okay, so kahit ito lang yung tandaan mo, cholinergic effect is just, a fancy word for too much mucus. Repeat, it's just a fancy word for too much mucus. Pag marami kang sipon, or if you have fluid in your lungs, mga ganyan, produced by, of course, your body, ito yung sinasabi nating cholinergic effect. Okay? If there is a cholinergic effect, there is an abundant fluid in the alveoli. Para sa yung alveoli, it's where the magic happens. Okay? It's where the gas exchange happens between O2 and CO2. Remember, the lung, specifically the alveoli, is your link. The link between the respiratory system and the circulatory system. And so we have a big problem if there's fluid in the alveoli. Okay? Abundant fluid in the alveoli means decreased gas exchange. Pero yung goal kasi natin ultimately is adequate gas exchange. And we can't do that if there is fluid. The effect of fluid in the lungs is coughing a lot of mucus. This is where infection sets in. An example of which is yung sinasabi nating pneumonia. Anticholinergics or bronchodilators simply turns off the system that causes fight or flight. Narinig mo na yan. Okay? The difference between the two, yung sympathetic nervous system and the parasympathetic nervous system, is the sympathetic nervous system is the one that freaks you out, or otherwise termed as the stress response or the fight or flight, aka stress. Okay? It freaks you out. So either yung katawan natin is fighting or flighting. Okay? Note, the job of your SNS and PNS are completely opposite to create a condition called your homeostasis. And your parasympathetic nervous system, as with the picture, nakikita mo si Naruto and si Jiraiya, if you're a fan of those animes, ano ginagawa nila? They are meditating. Exactly what it means to me pag sinabi nating parasympathetic nervous system, because this system or parasympathetic nervous system calms you down, or otherwise known as the rest and digestion. Itong dalawang to, yung sinasabi natin, sympathetic nervous system and your parasympathetic system, on my mind, naglalaro sila na parang seesaw. Yung isa minsan nasa taas, yung isa minsan nasa baba. Meaning, ano ibig sabihin yan? Meaning, they take turns kung sino yung gagana. Pwedeng si sympathetic nervous system muna, pwedeng si parasympathetic nervous system yung nasa baba. And tataas din naman si parasympathetic nervous system. And mag-o-off muna si sympathetic nervous system. The important thing to remember when these are involved, yung sympathetic nervous system, is when this happens, okay, yung binibigyan ng importance, or yung sinasabi nating ina-activate, are yung sinasabi nating respiratory system. Kaya ano ginagawa niya? Ino-open up niya yung system na yan to accommodate more air. Bakit? Kasi nga fight or flight eh. Pag sinabing nervous system, it's the stress response. Either you're fighting or flighting, but whichever, fight or flight, whatever happens, kailangan mo ng mas maraming oxygen. And in turn, sabi nga natin, yung respiratory system, meron siyang partner. And its partner is yung cardiovascular system, or yung sinasabi nating circulatory system. Yung circulatory system is subdivided into three. Your cardiovascular system, yung heart, yung blood, ano pa, and the peripheries. And so its effect is pang buong katawan siya. But most importantly, yun yung mga ina-activate niya. Of course, it activates your brain, your senses, yung sa mata mo, it dilates. Pero for this lesson, let's focus on particularly those two things, yung sa respiratory system and sa heart natin. Okay? When your parasympathetic is turned on, okay, it calms you down. Okay? Ang tino-turn on or ang ina-activate naman niya na mga system are your rest and digestion systems. Ano ibig sabihin yan? Yung excretory system, ano pa? Your digestive system, yan. And so, with that turned on, naglalaway ka, nagugutom ka, nasi-CR ka, napapawiwi ka. Okay? So, in short, it calms you down. And kung mapapansin mo, yung sympathetic nervous system, when it's turned on, itong mga digestive system, digestive system or excretory system is turned off. So, hindi sila gumagana, or kumbaga, gumagana pero minimal effect. And vice versa, if your parasympathetic nervous system is activated, those that is activated by your sympathetic nervous system, hindi naman sila pinapagana or naka-sleep mode sila. Okay? So, when we talk about the sympathetic nervous system, the blood goes to the heart, muscles, lungs, and brain. It may also be called the sympathomimetics or your anticholinergics. Ulitin ko. This may be called your sympathomimetics or anticholinergics. So meaning your sympathomimetics or anticholinergics is one and the same. Ang daming tawag, pero when you think about it, isa lang naman pala yung effect. Okay, so remember that. So anticholinergic simply means you are not urinating, you are not digesting. Okay, so ano yung naka-turn on pagka sympathetic nervous system? It's your fight and flight. For COPD patients, if there is decreased fluid, there is decreased wheezing. Okay. For PNS or your parasympathetic nervous system, the blood goes to the GI, kidney, and excretory system. That's why napupup ka, naiihi ka, nagugutom ka. It's called your parasympathomimetic or cholinergic effect. Cholinergic simply means you are producing saliva, digesting enzymes, or urinating fluids. Okay? And so, knowing what we know, let's finally turn to anticholinergics. Ano ba yan? So, sabi nga natin, when you talk about cholinergic, it's just a fancy word for saying there's too much mucus. Okay? And so, anticholinergics are drugs used for the maintenance and treatment of the bronchospasm associated with COPD, meaning these are the agents that bring down mucus production in those pathways, the bronchi and the bronchioles. Okay? Doon sa dinadaanan nga ng lungs natin, yung mga nag-expand, tapos lumiliit, nag-expand, lumiliit. Okay? And with that, it helps dilate the bronchial tubes, yung mga nag-constrict, idadilate niya. Is that better? Of course, yes. Ang gusto natin, yung respiratory system is adequate gas exchange. At kapag may problema, ini-employ yung respiratory drugs. And so, ang dalawang problem natin is padilating natin yung mga nagko-constrict, and if there is fluid, tanggalin natin yung fluid. Kasi if there is constriction or increased fluid or both, then gas exchange is decreased. So, it is administered via inhalation and meds that end in pium. Example, you have your tiotropium. Yan yung pinaka laging nakikita sa mga books. Okay, ends in pium. The common side effects are your dry mouth, constipation, vomiting, dyspepsia, abdominal pain, depression, insomnia, headache, joint pain, and peripheral edema, all of which are the side effects of if your sympathetic nervous system is activated. Okay, so dry mouth, constipation. Kasi yung fluid nga nawawala eh. And so these are the side effects. On the next page, we have your different anticholinergics. Okay. And last for the team Broncos, the M is your methylxanthine derivatives or your xanthines. They stimulate the central nervous system or the CNS and respiration and dilates coronary and pulmonary vessels and cause diuresis. Causes sympathomimetic response. These agents increase the heart rate and dilates the lungs to make breathing better. Used for the treatment of asthma, and commonly these are drugs ending in phylline, and the most common of these drugs are your theophylline. So, lagi mo siya makikita dyan. And these act as your sympathomimetics and turns on your SNS or your sympathetic nervous system to bring more circulation into the lungs and expand the airways. The next are anti-inflammatory agents. So, tapos na tayo sa Team Broncos. Let's talk about SLAM or SLM. The first one is your steroids or glucocorticosteroids. They are the ones that cause smooth muscles, bronchi, and bronchioles to relax. Glucocorticosteroids and steroids are effective for treatment of allergic rhinitis because they produce an anti-inflammatory action. It decreases symptoms of rhinorrhea, sneezing, and congestions, and these drugs usually end in son. Glucocorticosteroids are used to treat respiratory disorders, particularly asthma. It is indicated if asthma is unresponsive to bronchodilator therapy. Repeat, ulitin. It is indicated if asthma is unresponsive to bronchodilator therapy or if patient has an asthma attack on a maximum dose of theophylline or an adrenergic drug. This can be given through inhaler, tablet or IV, and anti-inflammatory drug used for COPD. So these are the list of your glucocorticosteroids. L stands for leukotriene or leukotriene modifiers. These LT modifiers are effective in inflammatory symptoms of asthma triggered by allergic and environmental stimuli. I repeat, leukotriene modifiers or LT modifiers are effective in inflammatory symptoms of asthma triggered by allergic and environmental stimuli. LT receptor agonists and LT synthesis inhibitors are called leukotriene modifiers or LT modifiers, primarily used for the treatment of exercise-induced asthma and anti-inflammatory drug used for COPD. Mast cell stabilizers or cromolyn. Now, meron dalawang definition, one given by the book and one a simple definition. The fancy definition is that cromolyn act by inhibiting the release of histamine and other inflammatory properties from mast cells to prevent an asthma attack. Okay? But the simple definition means is that it stabilizes mast cell and reduce swelling. So when I was introducing yung M, yung mast cell stabilizers, meaning these mast cell rush into your smooth muscles, bronchi and bronchioles, and when this happens, the bronchi and bronchioles become inflamed and puff. So yung cromolyn simply addresses that particular mast cell or yung sinasabi nating mga histamine, etc. to prevent an asthma attack. For other respiratory drugs not mentioned, I'll be discussing it here. First, you have your antihistamine. Okay, it decreases your nasopharyngeal secretions by blocking H1 receptors. They are commonly used for cold remedy, but may also be used for the treatment of allergic rhinitis. Antihistamine may also be called H1 blocker, H1 agonist, compete with histamine for receptor sites and prevent histamine response. When H1 is stimulated, the extravascular smooth muscles, including the lining of the nasal cavity, are constricted. Now, there are two types of antihistamine, the first generation or the first gen and the second generation. So, itong dalawang to, pareho pa rin ginagamit. Okay? But, I prefer, if possible, yung second generation. Why? Let's talk about that. For the first generation of antihistamine, it causes, or the side effects are drowsiness, dry mouth, and anticholinergic symptoms, and are often over-the-counter drugs. Meaning, when you walk into a pharmacy, mabibili mo to. And an example of this first generation antihistamine is your diphenhydramine. Usually, na ano to sa mga bata. Merong medication na pambata na ganito, itong Difen. Okay? Or minsan may nakahalo sa gamot ng mga, yung cough syrup. The most common side effects are drowsiness, fatigue, dizziness, disturbed coordination, skin rashes, dry mouth, urine retention, blurred vision, and wheezing may also occur. So, pag gumagamit ka ng medications ng first generation, usually, for example, gumamit ka niyan, yung diphenhydramine, that's an example of the medication. Dapat, if you're driving, okay, huwag ka na muna mag-drive kasi asahan mo, aantukin ka, makakatulog ka, and you cannot help it. Mahihilo ka or magkakaroon ng problema sa coordination. So, if you're drinking diphenhydramine or first generation, dapat may kasama kang iba. If you're going to work, mag-taxi ka na lang or whatever available transportation is necessary. However, dapat may kasama ka or magpasundo ka pero hindi ikaw yung magdadrive. For the second generation antihistamine, they have few to none of the side effects of the first generation antihistamine. And so, comparing the two, konti lang yung side effect nitong second generation. However, the difference is the price. Mas mahal yung mga second generation. Okay? Have little to no sedative effect. So, yung first generation ka, yung mga common side effects niyan, yung shortcut niyan, lahat, sedative effect. There's lack of coordination, dizziness, fatigue. And kapag second generation na ginagamit, itong mga effect na to, it's either from zero to no effect. Pero meron pa rin. Of course, when you're taking antihistamine, you have to understand that you're not supposed to take alcohol. Kasi nga, downer na nga itong gamot na to eh. Tapos iinom ka pa ng alcohol. So, that's a no-no. Patients who have undertaken the first generation antihistamine should be advised not to drive or operate dangerous machinery until the effects have settled. And there are different types of antihistamines which is available for you, which is written. Decongestants. Decongestants stimulate the alpha adrenergic receptors. It's part of your systemic nervous system effect, producing vascular constriction of the capillaries in the nasal mucosa. In other words, it shrinks the mucous membrane and reduces fluid secretion when one has a runny nose. So, I'm sure everybody has experienced runny nose. So decongestants is the go-to drug. And yung perfect example na itong decongestants na to is yung Nuzep. Okay? Can be administered via capsule, nasal spray, drops, tablets, or in liquid form. Abuse of this medication may cause rebound nasal congestion. The effect is vasodilation instead of vasoconstriction or irritation of the nasal mucosa. So, yung kabaliktaran yung nangyayari. Imbis na vasoconstriction, vasodilation yung nangyayari. Okay? And The side effects can make patients jittery, nervous, or restless, but disappear when body adjusts to the drug. So, yung common dito is yung phenylephrine hydrochloride, Nusep yan, and your tetrahydrozoline. Antitussives and expectorants. First, let's discuss about antitussive. This class of drugs act on the cough control center in the medulla to suppress cough reflex. Cough is a natural protective way to clear the airway of secretions, and it's an OTC drug, meaning you can buy it in the counter if you wish. There are three types. You have your non-opioid, opioid, or combination of the two. It's the most common. Isa sa example nitong antitussive na to would be your Sinicod or Sinicod Forte. On the other hand, expectorants loosen bronchial secretions so they can be eliminated by coughing. Ito yung sinasabi natin pagka yung mucus, yung masyadong malagkit. Okay? Ayaw lang kahit na umuubo ka na, gumaganyan ka na, ayaw pa rin mawala. And so you take expectorants, or ito yung binibigay ng doktor, expectorants, so that yung mga pesting ano na yan, mucus na very makapit can be expectorated, can be found in many OTC cold remedies along with your analgesics, antihistamines, decongestants, and antitussive. And the most common is your guaifenesin. So, yung iba, ang sabi nila, expectorants are used to assist or loosen mucus from the airways, while mucolytics acts as detergents to liquefy and loosen thick mucus. And of course, your antibiotics, although discussed, bigyan lang natin ng konting discussion, are only used if bacterial infection results from retained mucus secretions. Ito na yung mga pneumonia, etc. Yung mga ganyan. So in summary, the ultimate goal of respiratory drugs, kahit na anong drug pa yan, basta respiratory drug, the ultimate goal is adequate gas exchange. And kahit na ano pa yan, either team broncho or team anti-inflammatory, it addresses the same problem. And that is pwedeng number 1, vasoconstriction, and number 2, fluids or overproduction of mucus. And those drugs, kahit na ano pang drugs na yan, addresses those two problems to increase or to better gas exchange. Thank you very much for listening and have a good day. Thank you.